All right, it is just after the top of the hour and we have a lot of presentations to get through today. So I would like to officially welcome everyone to the webinar today and thank you all for joining from all different parts of the world that you're in. I know there's lots of webinar opportunities with flying around right now with everything happening with COVID. So we are very appreciative of you taking your time in this hour to learn more about OpenLMIS and how it can be leveraged as a tool in the country and global level COVID response. So to begin today, I'll just start with a couple of housekeeping notes. We will be keeping our participants on mute throughout the presentations, just given the high volume of participants that we have to limit some background noise. You won't be needing your videos, so you can shut those off because we'll be using screen share. But we will, however, encourage you to share comments and questions in the chat throughout the presentations. We will have our colleague Sierra Petrosky monitoring the chat. So if you have any issues or questions, technical questions, connection issues, Sierra Petrosky is a point of contact you can write to in the chat. And following the webinar, we will be sharing these slides as well as some additional resources and links that are relevant to the presentation. So yes, you will all receive these slides if you've registered for this webinar. So let's meet our speakers for today. I'll first introduce myself. I'm Rebecca Alban, the OpenLMIS Community Manager, joining from Spain today. We'll be hearing from Gaurav Bhattacharya, who's the Director of Information Systems at the Clinton Health Access Initiative from London, England. We'll also hear from Wes Brown, who's the OpenLMIS Product Manager in Nairobi, Kenya. Josh Zamor is the OpenLMIS Architect, and he's coming to us from Seattle, Washington today. We'll also hear from Carl Leitner, who is the Technical Director at Digital Square and is in North Carolina in the USA. And we have Christine Lenihan, who is the Director of Information Systems at Village Reach, also in Seattle. So we want to send a special thanks to all of these excellent public health and technical experts that we have with us today. We're very lucky to have snagged them all on short notice to be with us today. So thank you all. Here's our outline for today. First, I will do a quick introduction to OpenLMIS as a software for those of you who are new to the tool, and then review some of our key principles for the OpenLMIS COVID response. And then we will see our new and exciting OpenLMIS COVID-19 tool. We'll get a description from Gaurav about how the tool works and the vision for the tool. And then we'll actually get a live software demo from Wes to show us how the tool works in action. And then Josh will talk us through the benefits of using standards for interoperability. And Carl will introduce us to some exciting work that the OpenHIE COVID task force is doing in this area as well. And then lastly, we'll hear from Christine to talk us through some adaptations to their current OpenLMIS systems that are being made in Malawi to serve some of their needs for COVID. And with any of the remaining time we have, we will wrap things up and take Q&A. So without further ado, I will jump in and begin. So first, just to frame quickly, what is OpenLMIS? I know some of you are familiar with the systems and others may be the first time you're hearing about it. So OpenLMIS is an open source software that helps countries maintain their public health logistics systems so that they can know where stock is, when they're running low, and it allows you to have accurate data at your fingertips to inform when new products should be ordered. The system is being used in 8 countries right now in multiple languages, and our user base is growing every day. We've currently got over 11,000 users on the African continent, and you can see the current countries it's being used in are highlighted on the map in blue. One of the biggest benefits of OpenLMIS is that it makes data visible and easily shareable within a health system. You see the image on the screen is an example of one of the many visualizations like graphs and dashboards that the system can create. And this particular one shows stock status. indicating the number of facilities that are showing stockouts or are not adequately stocked with their medical products. And this type of information is really crucial for people who sit at the national and district levels to be able to oversee and make decisions about supplies and allocations, and to see trends over time in their supply chain. So answering questions like, do I need an emergency order of supplies? Or do I have a supply bottleneck somewhere in my supply chain? Or do I need to advocate for more funding for certain products? So having this type of data from OpenLMIS can help inform those types of decisions. So that's generally how OpenLMIS has been used in the past 8 years to support countries. And now we find ourselves in this time of COVID, this sort of unprecedented time when things are changing. And supply chains are changing. They've been deeply impacted by the pandemic, and it's created supply delays and lots of uncertainty for product availability. Globally, we're seeing that there's insufficient PPE to go around and a need to scale up testing. And I know many of us on this webinar today have been charged with finding solutions to these issues and helping our countries get the supplies that they need to curb the effects of the virus. And OpenLMIS is evolving to support this global response effort. So the webinar for today wants to answer a couple of different questions. First, how can OpenLMIS help to maintain essential primary healthcare services? We know during emergencies, such as Ebola, that primary healthcare can be the first thing to suffer. And when it suffers drastically, that can actually cause more morbidity and deaths than the public health emergency itself. So stability in product flow and the need to avoid these other possible knock-on effects of the virus is what OpenLMIS can contribute in terms of maintaining essential health services during COVID. And the second thing is, how can OpenLMIS help us to plan and manage COVID-related supplies in our countries to ensure that healthcare workers are equipped to diagnose the disease and also protect themselves from contracting the disease? So here's how OpenLMIS can help maintain essential health services during COVID. OpenLMIS is designed to improve data visibility and let you see how all the different pieces of a supply chain interact and inform decision-making. It makes faster, easier, and more accurate reporting data available for supply chain managers. And particularly in an emergency, when we know supply chain managers need to make decisions quickly, having these types of graphs and dashboards available at your fingertips can really help quick responses to the evolving needs in countries. And we do expect to see changing consumption and demand for a number of different products as a result of COVID. We're seeing cancellation of vaccination campaigns. Some facilities are being repurposed for COVID treatment centers. And so OpenLMIS is a tool that can really help keep a finger on the pulse of what is being used in terms of products and what the immediate needs are for health facilities to respond to COVID effectively. This image is of a pharmacist in Malawi using the OpenLMIS system. He can keep track of his inventory in real time to always know how much stock he has on hand. It helps him to take physical inventories, to file his reports, and to submit orders of stock at the end of the month. And to make his life easier, OpenLMIS auto-calculates his reports for him and has some built-in data quality checks to make sure all of his data adds up. So these are some core principles that OpenLMIS is thinking about as we approach the COVID response, and we'll actually be referring to these throughout the webinar, so I'll just review them all now. The first is that we believe that the best way to strengthen health systems is to do that through the Ministry of Health, and with the Ministry of Health in the driver's seat, setting those priorities and national strategies, and then that it's our role really to create systems that respond to those needs. So linking with that national effort. We also think it's important for country data to flow upwards and plug into the global emergency supply chain efforts that are being organized. And I'll talk a little bit more about that in a minute. The second principle is building off of existing systems. emergencies aren't a great time to build and introduce new digital solutions. This takes time and training and buy-in. And we believe that this emergency is actually an opportunity to strengthen existing national health tools, and that this can actually have a benefit throughout COVID, but also beyond COVID in the long term for countries to continue to grow. And OpenLMIS is one of the many proven solutions that has wide user bases in countries. And so that's why today we want to show you a couple of different examples of how OpenLMIS can be built on to meet country needs for COVID response. The third principle here is the use of global standards for interoperability. And we think this is a valuable strategy to link to existing health information systems and allow them all to connect and sort of speak to one another so that it creates a more cohesive and coordinated response. So I'll begin just by talking about this first principle that we've illustrated here. So this is a diagram of the global emergency supply chain for COVID, which is being coordinated by the WHO and a number of other partners. So there's a lot going on in this diagram, but really what I wanted to focus on was the flow and how the flow from countries is being consolidated into this sort of center of the diagram, the global ordering and distribution process. So you see country financing flows into the catalog, which flows into demand management. And actually, this is the piece where OpenLMIS fits into the mix in terms of creating that demand data from our countries. OpenLMIS enables you to have a strong national level picture of consumption and your future needs. And for that data to be sort of trustworthy and reliable and have some meat behind it. This data is then fed into the global control tower, where country requests for products are being reviewed and then processed at the central or the global level. And it's this control tower that will determine the types and the quantities of products that are going to be distributed on behalf of the WHO and UNICEF. So this is the latest diagram I've seen of how this is going to be working. As part of the follow-up email that we'll send from this webinar, we will send more details and related links to these different mechanisms. For example, the essential supplies catalog is now online, and we can send you the link to that. So we'll be following up with more information on specifics and how to plug into these global mechanisms. I also just wanted to show some more examples of the types of dashboards that OpenLMIS can create. As I mentioned, demand does change quickly in emergency situations, and these are the types of reports and dashboards that OpenLMIS can highlight changes in things like consumption and stock status to enable quick and proactive responses. And this is just another visual example of the types of reports that can be generated. I wanted to show this because you can really drill down as far as you want to go, down even to the individual facility level, or kind of zoom out and have a macro level view of what's happening in the entire country, and using maps or circles and all different sorts of formats of maps. Okay, and now I wanted to shift gears for a second and hear from you all. We are going to attempt technologically to launch a Zoom poll, so hopefully this works. But the question that we want to answer from all of you is, in the countries that you're working in or the countries that you're supporting, what is the plan for managing inventory for COVID-related supplies? And Sierra, if you're able, you can go ahead and launch, and I'll just describe the question. So there's 4 options that we've put here as potential responses, because we've heard some countries are planning to use Excel. We've heard that others are going to be building off of their existing ELMIS systems and sort of augmenting their existing tools. We know some are looking for new tools and not quite sure what they're going to use yet, and others just may not know. Sierra, is the Zoom poll working?
Yep, it's working, and we have about half of the people have answered so far.
Oh, fantastic. Okay, so just I can't see it because I'm sharing my screen. Thanks. Okay, so we'll give maybe another 20, 30 seconds for people to respond. And then, Sarah, if you don't mind, since I don't think I'll be able to see the response, the final response, could you maybe just do a quick readout of what the answers are?
Yeah, no problem.
Top responses are. Thanks.
Looks like just a few more answers are coming in.
Great, thanks. I'll follow your lead in terms of when's the right time.
Okay, it's looking like 27% of people said Excel, 39% said existing ELMIS, 11% said looking for a new tool, and then 22% said not sure yet.
Great, very interesting to hear. So hopefully for those of you who are looking for a new tool, what's coming up next is the OpenLMIS tool. So that could be a potential thing that could be a fit for your needs, but it's very interesting to hear what others are doing. So thank you for sharing, everyone. So the next presentation about the global tool, the COVID tool, sorry, is in relation to the second principle, building off of existing systems. So I will now turn things over to Gaurav to describe our new OpenLMIS tool for COVID.
Thanks, Rebecca. Hi, everyone. I will give an overview of the OpenLMIS for COVID tool, why we decided to build it, its capabilities, the principles that guided us in creating it, its current status, some deployment parameters, including transition, and how countries might use it in the longer term. As you all know, there continues to be a global shortage of COVID-related supplies. Even well-resourced countries like the US and the UK have struggled to provide PPE and tests at the desired levels. We also know that stocks need to be at the right facilities at the right time and in the right quantities, but often we see overstocking and stockouts of the same commodities at different locations within a country. When commodities are in short supply, it becomes even more important to make sure that they are managed more closely. Countries are likely going to be also on a weekly replenishment cycle, making real-time data visibility and highly responsive supply chain decision-making critical. Having real-time visibility into actual demand is also critical during this time, so countries can procure optimally or request supplies in rational and realistic quantities from the WHO, referring back to the slide that Rebecca just showed. As the pandemic unfolds, we came across a number of countries that started off with Excel, while some were looking to adapt their existing systems to manage COVID commodities, be it OpenLMIS or DHIS2, which is not necessarily meant to be an LMIS. These are huge gaps that need to be filled urgently. Next slide, please, Rebecca. Thank you. OpenLMIS is a well-known open source electronic LMIS that is highly flexible and extensible. We thought OpenLMIS, configured specifically for COVID, would be a useful tool for countries looking to quickly build capacity to manage their in-country supply chains. So CHAI, in partnership with Village Reach and Soldevelo, came together to create this tool that offers stock management at all levels of the supply chain, creation, submission, and approval of requisitions and replenishments, proof of delivery to track shipments and order fulfillment, monitoring and reporting the location and operational status of ventilators and other equipment, dashboards and reports to track consumption, understand demand, and manage the program, and product catalog management to create and update product lists. Product catalog management is, I think, especially relevant as more tests and eventually a vaccine is introduced. And so being able to easily update your product list becomes quite important. We'll briefly describe the product catalog management tool, or PCMT, later in the webinar. Next slide, please. Thank you. So our approach was based on the need to deploy rapidly, so countries could start using the tool as quickly as possible. So the tool is cloud-based, which avoids in-country infrastructure requirements and technical human resource requirements as well. It's also standalone, so it does not interfere with existing tools for routine programs. Countries with functional ELMIS may choose to add COVID commodities to their system. However, we recognize that not all countries have a functional ELMIS that is flexible and easily extendable to add a COVID program, or have the technical support required to make these changes. Using a standalone tool also prevents any potential disruption to existing systems. The other main consideration was deployment timelines and ease of use. In order to have a system that was faster to train on and easy to use, we chose to offer a single program, which is COVID, and simpler workflows, even though a full deployment of OpenLMIS can offer multiple programs and sophisticated configuration options. We also integrated PCMT, the product catalog management tool, so system administrators had access to simplified product management capabilities. Next slide, please. So in terms of status, the reference instance is ready and you may access it at this link. This link is also on the webinar flyer or email you must have received. Master data collection templates and other resources for deployment support have been developed as well and are available on the same link. And we expect to finish advanced reporting and dashboarding capabilities by end of this week as well, the kind of dashboards that Rebecca showed earlier. Next slide, please. So I'll take a couple of slides and talk about deployment as well as transition. So in terms of deployment timelines, it will take about 4 weeks for the system to be operational once we receive a request from the Ministry of Health. And this timeline includes master data gathering, country instance creation, master trainer and system admin trainings. Meeting these timelines would depend on how quickly we can get the master data from countries, high quality data from countries. And user trainings conducted by master trainers is not part of this timeline. Since this is a cloud-based system, the only infrastructure requirements is in country will be computers and internet access for end users. So what costs are covered? The tool is open source and offered for free. We'll conduct training sessions for system admins and master trainers, as well as provide training materials. We will also consider adding any new features and workflows to the reference instance if they benefit the COVID response and are also requested by multiple countries. This will only happen in the next phase, and we will assess these requests on a case-by-case basis. Next slide, please. So while the tool is open source and offered for free, using it does come at some cost that countries would need to bear. These include hosting costs, which would be around $500 to $600 a month, depending on the scale of implementation. So a Nigeria is not the same as a Lesotho, for example. And user training costs would also need to be secured. And system admin and user support costs will also be there. And in addition to these, some other unsupported costs include requests to change configurations, any customizations to the system that was initially offered, and extension to add other programs like vaccines or HIV, etc. So while these might be important to countries, we do not have the resources to support these requests at this time. We are prioritizing making the most critical functionality available to as many countries that require it. Okay, so transition. We aim to hand over the tool to countries in about 4 to 6 months post-deployment. At this point, we would expect the ministries to take on full ownership and maintenance of the system. Countries may decide to change configurations at this point or customize the tool to their specific requirements or extend it to include other programs as well. And what we can do is provide support to countries in sourcing the technical support required for maintenance and support or for any changes that they might want to make to the system. Next slide, please. So again, tying this to the Ebola response and the systems deployed there and how the complaint was that they were not sustainable, that after Ebola, it didn't, they weren't used or they weren't useful. Usability beyond COVID becomes an important consideration as well. And so here I'd like to highlight that OpenLMIS supports OpenHIE-based interoperability and can interface with DHIS2 and systems like OpenSRP and other OpenHIE standard compliant systems. A huge benefit to countries who decide to deploy this tool is also that OpenLMIS is flexible and extensible, and the COVID instance can be expanded to manage all programs, including vaccines. Such an extension will be a separate project, obviously, and we can take on those requests on a case-by-case basis as well. So that's the overview. Thank you very much. And I'll hand over to Wes now to give us a demo of the system itself.
Thanks, Gaurav. Let me just share my screen. And if someone could just let me know when my screen comes through.
I can see
it's
it.
up.
Excellent. So my name is Wes Brown. I'm the technical product manager on the OpenLMIS project. And today I'm going to go through a quick demo. And I'm going to show you a very common workflow that we have and the workflow that we've set up for this COVID-based system. We'll be starting as a facility user and doing a physical inventory of what we have on hand, and then showing how that information can flow into a request for new stock, what we call a requisition, what the approval process is for that requisition, how that requisition turns into an order, is fulfilled, and then finally a proof of delivery is delivered to the facility to kind of complete this cycle. So we'll go through this. I'll try to go through it quickly, and then we'll have time at the end of this webinar for Q&A. I did just see one question, by the way, asking about whether or not the system supported translations. And I do want to just highlight that it does. We include I think we have not a full translation for Spanish, but we do for French and for Portuguese. So yes, we can translate the system to other languages. So to start, I want to highlight that these menus here are for this specific user. So I'm logged in as a demo user here we've set up as a pharmacist. And so they can only see the menu items related to them. So there's an admin menu item that would normally be available, but this user does not have access to be able to see that. So these menus here are user-based, depending on the role that you are. We're going to start as a physical inventory. So we can see here, we've set up this COVID program, and we're looking for the facility that this user is set up to manage, a facility we've called the Lilongwe Central Hospital. So I'm going to start, and I can see here, the system is showing me what it thinks I have on hand right now. And so the way that you would use this page is, another word for this activity would be called a stock take, where you would be going through and you'd be entering in, the system thinks that I have 288 stock on hand. How much do I actually have? So I actually do have 288 and I have 40, but here I only have 180. I did my check and I can see that there are 10 missing, and it's highlighted here to see that there's an unaccounted quantity of 10. So I can go in and I can say what happened to those. I may not know, maybe they're just lost. And so I can say that I lost 10 of them. And now we can see that the unaccounted quantity is 0 and that I've lost 10. I won't go through this whole process just to save some time, but normally you would do this on probably a monthly or a quarterly basis. But then this information flows into the request for new stock, something we call a requisition. So I'll go to the requisitions and I'll search to see what periods are open. Now, because this is demo data, we have old data from 2019. Normally the user would see the period for the date period that they're in right now. But for this demo, I'm going to start from November 19th, week 4. And what I see here is a list of all the products that have been defined in our system as what we call full supply products. Now, these would be things you would normally see like essential medicines or things like that. In this COVID system, it's all COVID related commodities. We also have another tab here for non-full supply products. These are things that are not always required. So full supply would be things you should always have on hand. Non-full supply would be things that you may have on hand, but you don't necessarily always need to have. So I'm just going to do a requisition for a couple of items, once again, in the interest of time. So we'll just select these two here. And so I can see this information coming over from our physical inventory page, from our stock on hand. So I can see that the system knows how much I have on hand. It knows if there was any changes to that stock over the last, during the last period. So in this case, this is the demo system. We actually haven't had any changes. And so it can tell me, so I started with 150. If there was any changes, it would tell me how much was left and then be able to calculate how much it thinks I should order. Now, in this case, we don't have any usage. So I'm just going to put some fake data in. So I'm going to say I want to order, let's say I want to order 35 more masks. And I want to order 10 new aprons. We can see here the packs to ship is being updated, and it's different in some cases than the quantity requested. So for the respirator masks, we can see that the number of individual respirator masks that I'm asking for, or masks, must be shipped in packs of probably 10. So we can see that I'm actually going to get 4 packs, even though I'm only asking for 35. And then we can see that this price is updated on the fly as I change things. So if I were to change this to 11, we can see that total cost changes with it. So I'm going to click Submit and Authorize. This is a process that can be split apart into a submission and an authorization step. But for this demo, we've kept it simple and just had them combined. So now I've created this requisition at my facility, and I'm going to log out and now log in as a user higher up in the health chain. So this would be maybe a district or a regional user. And when I log in as this user, I go to approve the requisition I just created. So I can see here's the requisition I created. I'm going to go look at it. And I can see here's the information that I added to that requisition we were just working on. So I can see here I've requested 35 of the masks. I've requested 10 of the aprons. I can see the cost and the comments here. But then I can also make changes, because I may know as a regional user that we don't actually have enough to be able to distribute 35 to every facility. So I'm going to have to reduce that. Reduced due to demand. But then for this one, shipping 10 is fine. That's okay. So I can say, I've made my changes. I can now approve this requisition, which will approve the requisition and turn it into an order. So now I've completed my job as the regional user, and now I'm going to log in as a warehouse manager. This user will be the one who converts the order that was created and starts the fulfillment of that order. So here's the order that we just created of the requisition that we created a moment ago. So if I click on the Start Fulfillment button, I'll be able to see what is being requested and then how much I have on hand to be able to satisfy that request. So I can see here I'm ordering 2. So this is now I'm looking at packs. I can see if I want to see doses, I can see the doses. But usually a warehouse user is going to be thinking in terms of packs, in terms of what they actually ship out to users, to facilities. So it wants to ship 2, and I can say, okay, I'll ship you 2. And then I see for the aprons, I want to ship, the order quantity is 10, but I may know, okay, I only have 100 on hand, so I have to be very careful about these. So I'm only going to ship 5. So there's opportunities to make changes and to be able to be flexible based on what you know as either a regional user or a warehouse manager versus what you are requesting at the facility. Those things may not always be the same. So I've made my changes now in terms of the packs that I'm going to be shipping, and I'll click on the Confirm Shipment button. This will generate a proof of delivery, and presumably I'm, as a warehouse manager, the shipment has been made, it's gone out on the truck or however it's being shipped out to the location. Now, sometime in the future, I'm going to log back in here as the pharmacist, and I'll be able to see now, let's say it's a couple days later, and I've received that shipment. So now I would go in and I would say, okay, I want to see all the proof of deliveries that have been created. And I want to find the one for November, week 4. And I click on the Manage button. I can see that it's shipped. And now it's telling me exactly what was shipped. So I can see here was the ordered amount, where I said, okay, I wanted 2, I got 2. I wanted 10, but I only got 5. So it's just letting me know that here's what I asked for, here's what I got. And then I can say, what did I actually receive? So I could say that, yes, I received 5 of these, but one of the boxes of the masks I don't have. And so I can say what happened to that. I can say it was lost, it was damaged, it expired. So in this case, we'll just say, well, one of them was lost. I don't know what happened to it. And then if I want to, I can add any notes related to that. And then to complete this, I just say it was delivered by, say it was delivered by DHL, it was received by myself, Wes. And this is when I received it. I received it today. And once I click confirm, this will update the stock at my facility. So now I've closed the loop. So then the next week or the next month, when I want to do another requisition, the information that's in my system about the stock on hand is already in place. I will highlight a couple of things here. First is that this is one of the 2 workflows that we've currently enabled for the COVID system. This one is what's called a stock-based requisition, because the requisition is being able to look at the stock information. If you're not able to use to record or track the stock information, you can also do requisitions that don't include the automatic calculation from the stock information. And instead, the user has to enter in that information as part of the process when they're doing the requisition. So that is OpenLMIS. There's many more features, much more flexibility that the system offers. As we've mentioned a few times, we are building a system specific for COVID right now. We're trying to keep it as streamlined as possible so that it's easy to get countries up and running on the system and easy to train users. But OpenLMIS as a system is built from the ground up to be incredibly flexible, very configurable so that countries can use it in a wide variety of settings for many different programs. So we hope that you are able to use it for COVID, and we hope that you find it a positive experience and are able to continue to use it for other programs down the road. Thanks.
Thank you, Wes. Just get my... Okay, I'm just getting my PowerPoint back up. Okay, thank you so much to Wes and Gaurav for that great presentation of the new tool. For anyone who's interested in getting more information about the tool, although we will be sending out the demo instance link and some supplementary information, but if there's anyone that wants to follow up with a meeting or to talk about the tool more, I'll be sharing my contact information via the chat and also put up on the screen my email contacts at the end of this webinar, so you can reach out to me to follow up and talk more about that tool. Our next presentation from Josh will be about the use of global standards for interoperability. So I will now turn the floor over to Josh.
Thanks, Rebecca. Am I coming through okay?
Yep, you sound good, thanks.
Alrighty. All right, hello everyone. My name is Josh Seymour and I'm the OpenLMIS software architect. So we have been looking a lot at OpenLMIS. And of course, OpenLMIS here is really focused and is key to supply chain. However, as we know, there are many more IT systems in a country that serve the broader health system. And some of them we've been talking about in the chat. So we wanted to show here this OpenHIE architecture diagram. And we can see we have many different systems that serve our labs, our pharmacies, medical records, health surveillance, etc. There's lots of different health systems that are out there, or different IT systems that are out there in our health system. And the way that OpenLMIS supports communicating with all of these different systems is through open standards. And so We know we have many of these IT systems that are also present at locations with health commodities, places that the supply chain reaches. And these open standards let us communicate with those systems that are also where that supply chain is reaching. And if we could go to the next slide. All right, so let's look at a practical example where OpenLMIS is using open standards to improve the supply chain's mission of serving health. Here we have a number of IT systems, such as some very back office systems, such as the ERP, which is serving our main warehouses. We might have our DHIS2 system giving the big picture of health for our population. And then we have some systems that might be getting closer to patients. OpenLMIS might be helping our health locations keep their medical supplies in stock. And OpenSRP might be recording direct patient interactions and the use of that medical stock. We can think of these two big boxes that we see here, supply chain management and health service delivery, as also just supply and demand. And open standards allow all of these different systems to communicate, to have a flow of information, to ensure that the supply of medical commodities is reaching the right patients at the right time for the right price. All of that's supported through these systems communicating with open standards. If we could switch over to the next one. And actually click one more time. There we go. So now if we, let's look at a new integration that OpenLMIS supports with PCMT. We mentioned PCMT a little bit earlier in the webinar, and PCMT is our product catalog. And PCMT is a master data management tool that lets you get a handle on your product catalog. All of the products that support health and all the items that are manufactured across the globe and which sit on our shelves. So OpenLMIS, where OpenLMIS supports matching supply with demand, PCMT dives deep into all the various products in your supply chain and supports robust organization and data cleaning, bringing everything you know about a product under one roof. Moreover, PCMT can help you understand your supplier's product catalogs and helps you map identifiers of products between catalogs, which will help you order the right amount of the right medical commodities. In this COVID response, we're setting up PCMT with OpenLMIS so that PCMT can aid the curation of your product catalog and align it with global suppliers of COVID supplies, such as PPEs. PCMT already has the WHO Emergency Global Supply Catalog for COVID-19 products set up within its standard data set, and that can help a country rapidly align their catalog that they're going to see in OpenLMIS to the WHO supply portal catalog. All right, and if we switch to the next slide. So PCMT fits into our OpenHIE architecture as a reference technology as a product registry or product catalog for your national IT health systems. We've talked about how PCMT can help a country align their catalog with global supplier catalogs. And here we can see that PCMT can also be used within your national architecture to be a source of truth about your product catalog to other systems in health, such as our lab systems, our pharmacies, etc. The more we have a single source of truth about our product catalog, the better we're able to match that supply with demand. And it makes our supply chain system more efficient and ensures that all our health systems have the right products at the right time. And with that, I'd like to say thank you and pass it over to my colleague, Carl, to introduce us to the OpenHIE COVID-19 Task Force. Carl?
Thanks, Josh. So I just wanted to talk a little bit about the OpenHIE COVID-19 Task Force, which is one of the communities within OpenHIE. This was established in early April to address some of the challenges that we saw in West Africa during the Ebola crisis there in terms of data exchange and interoperability, reflecting back on what happened there, even 1-2 years into the epidemic there. There were still massive difficulties in exchanging data between systems within country, much less cross-border. Knowing that the COVID-19 pandemic is at a much larger scale than the Ebola outbreak was we needed to rapidly come together to have a space to help mitigate those things from happening. So it's a weekly task force, Mondays at 11 a.m. Eastern, for our overall call, which is chaired by Garrett Mill from WHO, who sits on the new digital health team there, Terry Cullen from Regenstrief, and myself. We establish sub-working groups as needed, and I'll come back to how those are happening. And there's a wiki and our calls page are linked there. So if you're interested in joining, please click on that link, and we'll put that in the chat in just a second. We have similar values that guiding our work as that were expressed earlier for the OpenLMIS COVID-19 package, but basically you want to build on these existing systems and augment the work that's being there, but not interrupt anything that's being done on the field. Really think through how do we bring these systems together, less during this emergency response sort of short-term time period, but thinking through where we're going to be 3 months from now, 6 months from now, 9 months from now, what do we want those systems. This is a volunteer community. Everybody's bringing their expertise together. So if you know the fable of stone soup, that's sort of how we're approaching this, that everybody's got a piece of expertise to bring. Next slide. You can see the initial mapping of the work streams that we want to take up. This is a lot, and so we are not intending to fulfill all of those at least at the outsets. Whether we take up a work stream is whether somebody is going to be there to help drive it. Right now, we're focusing in on case reporting and mapping against the WHO case report forms, and providing a guidelines on how to submit the case report form using the HL7 FHIR standards, as well as some of the terminologies. We're also getting into some of the supply chain issues, some of the catalog issues that Josh alluded to are on top of that. And then we're looking at how do we link sort of these case reporting, supply chain use cases together through different data analytics and reporting needs. Next slide. And finally, we're also pulling together a number of resources that are useful for the COVID-19 digital response. And so here's a sample of the types of things that we're investigating, trying to reuse and identify how that can help accelerate our digital response to COVID-19. So please reach out to me if you have any questions about joining the group, and looking forward to working with you all on making sure the supply chain issues are highlighted and addressed by the task force. Thank you.
Thank you so much, Carl. And now we'll hand it over to Christine to talk to us about the work that they are doing in Malawi.
Thanks, Rebecca. Hi, everyone. I'm Christine Lenahan. As Rebecca mentioned earlier, I work on the digital solutions team at Village Reach. And I'm just going to talk very briefly about how Malawi is using OpenLMIS in their COVID response. So just some very quick high-level background. Malawi deployed OpenLMIS in 2017. Comonix GHSC PSM is the main implementing partner there, and Village Reach supported them to work with the Ministry of Health in deploying the system, and that's used at national scale for routine reporting and ordering for 6 different programs now. Go to the next slide. And so for the COVID response, there was a request from the ministry to add a new program to the existing system. So as has been touched on in this presentation, because OpenLMIS is very configurable and very flexible, it's relatively easy for us to add new programs or update any of the configuration to make sure that we can manage all of the products and things necessary for the country. And so we are working with the ministry to add that program with a streamlined and more frequent ordering and approval process, and using the existing reports to be, to help with the data visualization and visibility. And those reports can be filtered by program, so we can look at specific COVID commodities. And so that's our initial phase, and there are some additional considerations that we could make in the future if we wanted to include the use of the stock management capabilities for more real-time visibility, develop any COVID-specific dashboards, and potentially also the addition of the equipment management service. So those are additional features that are under consideration for future use after this initial phase. And yeah, that's the quick overview. So Rebecca, back over to you.
Thank you. Sorry, I was just coming off of mute. Thank you, Christine, and to everyone for their presentations today. I just put my contact email in the chat, but also wanted to highlight it here that I can be reached at both of these email addresses with any questions about OpenLMIS in general, or also to get more information or have a conversation about the OpenLMIS COVID tool that Gaurav and Wes showed us today. So that was the last slide that we have in terms of presentations, and I wanted to use the remaining time to do some Q&A and hear from you all. I also wanted to see if there's anyone on the line from the OpenLMIS Tanzania team. I know they had been doing some really interesting work as well, and they were potentially interested in giving a quick verbal update in this webinar. Is there anyone on the line who wanted to give that update? Okay, I'm taking the silence as a no. Well, if anyone from Tanzania is online and wants to share anything via chat, that is fine. Otherwise, Sierra, I don't know if you've pulled out any particular questions that have stuck out to you or that we haven't been able to answer on the chat that you wanted to read out to the group.
Yeah, that was a really lively chat. I hope people were able to follow along, and different members of the team did a really good job of answering things along the way, I think. A few that I pulled out, one earlier on was, is it possible to receive training on OpenLMIS customization?
I can start, and then maybe Wes, you can chime in a little bit more about how we can support. But initially, I can say that we don't offer specific training on that, but I recommend that people who have questions, technical questions about OpenLMIS, can engage in a couple of different ways. We do have a Slack feature that is very active on a couple of channels, particularly our help channel. So if there are specific questions that you want to funnel through there, we have a team of technical experts that are always monitoring that and answering questions all day. We also have an online forum where all of our different community committees convene, but also that's another place where if you wanted to have a more in-depth conversation or ask a more in-depth technical question, our technical or product committee would be well placed to help on that. Wes, did you have anything to add for someone who wants customization support?
Yeah, no, we do have some information about that on our website, on our wiki. I think the places that you mentioned, in particular, Discourse and Slack are going to be really good resources. the fact that the system is relatively easy to get up and running locally on a laptop, provided you have enough memory, means that you can kind of play around with things and see how to get it up and running, and how you can configure it using the documentation that we have. There is a little bit of a learning curve there, I'll be honest, but we do have plenty of options to be able to get more information should you need it. We also, I'll say too, that we also do have a number of partners who have a fair amount of experience with the system at this point, and who can also help as well.
Thanks, Wes.
If it's okay, I did want to answer one specific question that was raised, I don't think has been answered yet, just quickly.
Great.
And that was about the offline functionality of OpenLMIS, and specifically related, I think, to the requisitioning piece that we were going through in the demo. And I want to mention that that does have intermittent offline functionality, meaning if you can get online for some period of time, enough to be able to log into the system, then you can start a requisition. You can start working with what you're doing. So if you lose your internet connectivity in the midst of working on a new requisition, you can save it and it'll be available offline. And then when you're online again, you can submit it. So OpenLMIS does support that for requisitions. And so you can do your work if your internet connection is going in and out. OpenLMIS, however, does not support a fully offline system, meaning you can't like load it up when you're in your main office and then go out and use it for the whole day, and expect everything to sync up. So I mean, you can kind of do that, but it would be within some specific requirements. So we say that it supports an intermittent offline functionality.
Thanks, Wes. That's super helpful. And I also did see that someone had asked on the chat how to access the demo instance. So as a part of the follow-up email that I circulate, I can circulate the link as well to the demo instance for OpenLMIS and sort of the supporting passwords and logins that are needed for that, as well as the reference instant link that Gaurav shared about the OpenLMIS COVID tool, so that everyone on the webinar today will have the links to access those and play around with those if they want. Sierra, was there another question that you wanted to read?
There are a bunch. There's another one that just came in though, that I think might be good to touch on was, what are the operating system requirements for OpenLMIS?
I might funnel that one over to Wes or Josh.
And I just put a response in the chat, but essentially the operating system requirements is it runs on Docker, and the easiest one, the one that we support the most, is Linux. That's where Docker runs natively. But essentially anywhere Docker can run. So there are implementations of Docker on Windows and OS X and other systems. So it's mostly Docker. Linux is going to be the easiest one.
And I'll just add to that, Josh, you also mentioned the technical documentation that we have at docs.openlmis.org. The link is a little bit higher up in the chat. That's also a really good place to get information about how to get it up and running, what you need, and some of the more technical side of things.
Great, thank you, Wes and Josh. I think we've got 1 more minute, so maybe we can squeeze in one more question, and then we will do our best to collate the remaining questions that are coming through the chat and try to get some of those responses to you via email. So one more.
There were a few questions on interoperability between OpenLMIS and DHIS2. Maybe if we could touch really quickly on different systems that OpenLMIS can interoperate with.
Okay, I think
just to be sure that we don't to take advantage of the 1 minute. If there is really a big interest to implement the system in a Latino country, in Latin America, how easy is to implement at least the interface for managing the inventory and doing the forms in Spanish, or it will be like a lengthy procedure over?
Okay, maybe I could ask Wes to take the first question, that second question about implementing in Latin America, and then Josh touch on DHIS2 really quickly.
Sure, I can go quick. So in terms of getting the translations, that's actually a very simple process. We use a service called Transifex and are able to get translations very, very quickly. That translates most of the system at one go. Then as you're setting up the system in terms of the column headings and things like that on the requisition page itself, those are just, you edit those to be what you want them to be. So there's not, I don't actually think it's that big of a cost. It does take a little bit of time, especially if you want them the translations to be very context specific, as opposed to just general Spanish, for example. If you want something that's more, more applicable to the specific country that you're working in, or even region that you're working in.
And Jorge, just to add, yes, there is interest in Latin America as well. If there are countries that are interested in using the system, then we are interested in helping them.
All right, and then on the question for DHIS2 and OpenLMIS, so OpenLMIS does support HL7 FHIR resources, and the primary resources we're going to be interested in here are going to be the location resource, the measure, and the measure report resources. And so there is already an implementation of OpenLMIS that uses these resources to communicate indicators from OpenLMIS to DHIS2. Of course, there's lots of details involved in that, but that's the short answer to say, yes, OpenLMIS can send information on a continual basis to DHIS2.
Fantastic. Thank you, Josh, and thank you again to all of the different presenters who were here with us today. We are over time, so I'm going to cut things off now, and I do recognize that lots more questions came in over the chat, but we'll do our best to collate those, and as I said, send out a follow-up email with lots of different resource links and answers to those questions. So thank you to all of you for spending your time with us today, and we look forward to engaging with you and following up in the future. Thank you.
Thanks, everyone.
Thanks all.
Thanks all.
Stay healthy.
Thanks. Merci.
Take care, everyone.
Obrigado. Ciao, ciao.
Ciao, ciao.
Obrigado, tchau.
Como?